Good evening, ladies and gentlemen, and welcome to our guest speaker event for the GogoGetters. The Northumberland GogoGetters is an organization that formed about 5 years ago, and its purpose is to raise money to support the grandmothers in Africa who are raising HIV orphans. We give the money to the Stephen Lewis Foundation most of the time, and that makes us part of the nationwide Grandmothers to Grandmothers campaign, which probably most of you have heard about. We're not all grandmothers. It started out as being an organization for grandmothers, and I wasn't one at the time, but I am proudly a grandmother now, so I guess I'm a full-fledged member. But very quickly it expanded to become a grandmothers and grandothers. So we do have men in our group, and we have younger people who are involved as well, all supporting a very good cause. Our main focus is fundraising, although we do some advocacy because there are political issues involved in the support of the grandmothers as well. Our next major fundraising event is going to be a Scrabble tournament coming up in April. This will be our 3rd annual tournament. It's a lot of fun, and if you are interested in forming a team and competing, then you need to contact the website or the phone number that's on the bookmark that you were given as a receipt when you entered. If you're eager to get a team started right away, then you can speak to Greg Wadden. Greg, where are you? Yes, there's Greg. He's operating the video camera tonight, and he can get you signed up tonight. Now, my main purpose in being here is to introduce our guest speakers, and I want to tell you right off that this is a very special day in Naomi's life, because she has just seen her first snowfall. And we had to tear her away from the window. Naomi is the program director for CAP-AIDS Uganda, which is based in Kampala, Uganda. And she's also the director of the African program, because Kampala is the regional office. She is accompanied by Claire Holloway Wadhwani, who I know quite well, being my daughter. And they are going to speak to you tonight briefly, and then they're going to answer any questions that you might have. So I'm going to let them take over now.
Thank you, Claire's mom. It's very significant to bring that out. I'm so happy to be here today, and I'm so excited. So I was at the window, I was like, I've never seen snow falling. I was in Ottawa, and I found the snow already there. I also went skating, but I fell once. So I'm happy to see the snow falling. And I'm so happy to see this number turn up to hear about CAP-AIDS. Thank you for coming. Well, CAP-AIDS in full is Canada-Africa Partnership on AIDS, and it involves partnerships. For instance, we have the partnership with CAP-AIDS Canada, and then we have the Uganda office, which is in charge of the whole of Africa, to collect resources that will enable us be in position to resist, survive, and overcome HIV and AIDS in the African community. That is briefly our mission as CAP-AIDS. What do we believe in? We believe that there is nobody else who knows better than those community-based organizations that are down at the grassroots fighting the HIV/AIDS pandemic. And that's why we go straight and work with them. These are the groups like the grandmothers, whom we call caregivers, and then the widows. Yes, then we also believe that there is no shortage of community-based organizations. Okay.
Anything else?
Thank you. We also believe that there is no shortage of effective community-based organizations that in Africa. However, there is shortage of funds or resources in terms of knowledge, skills, and then of course the monetary resource. So there is no need to overlook the community-based organizations at the grassroots level, but there is need to work with them and provide them with the support. Then finally, what do we do? Not finally, what we believe. So what we believe finally is we should therefore work with the community-based organizations in order to be able to achieve our mission, which is to resist, survive, and overcome HIV/AIDS in the African community. What do we do as CAP/AIDS Uganda or CAP/AIDS Canada? With this partnership, we are able to partner with the grassroots community-based organizations who then put us in touch with the intended beneficiaries like AIDS orphans, the widows who have lost their husbands to HIV and AIDS, the grandmothers who are taking care of the AIDS orphan children, to help us reduce the spread of HIV and AIDS, provide relief, treatment, and comfort to the people living with HIV/AIDS, help orphans, the families, and communities cope with the effects of HIV/AIDS, and then also promote and protect the human rights of those affected or infected with HIV and AIDS. How do we do it? We do it through the famous mode of CAP/AIDS, which is partnership. The Canada office here, that my executive director is in charge of, helps us in collecting the funds. So they're in charge of fundraising. They also help us in technical knowledge in terms of writing proposals, project proposals, which we share together. And then when they get these funds, they transfer the funds to CAP/AIDS Uganda, which is in charge of the Africa region. And then when it is transferred to CAP/AIDS Uganda, we get in touch, again the partnership continues, with the grassroots community-based organizations that I talked of earlier that we believe are already doing the work, but they're not being recognized just because they don't have the leadership is not well built. Maybe they don't have an office, maybe they meet under the tree, like some of our projects when we just started. We were having our meetings under the tree, and then eventually with the capacity building, we were able to establish an office for some of them. Then afterwards, those partners help us to identify the intended beneficiaries. Let it be the grandmothers, who are in this case the caregivers in most cases of AIDS orphan children. They could be the caregivers of mothers who are infected with HIV/AIDS, who are in most cases in Africa isolated, and so they face stigmatization. So they end up in the hands of the grandmothers. Use of funds. What CAP/AIDS does is the donation process is mainly done by our international office. The financial administration is done by both the international office and the CAP/AIDS Africa office, which is based in Uganda. The monitoring and evaluation is done all the way through, right from my ED's office, the executive director, and down to CAP/AIDS Uganda, and then down to our community-based organizations who then monitor the intended beneficiaries. How do we select our partners? I mean the partners, in this case we mean the partners that we work with. We select community-based organizations that are in areas that are hard to reach, that for instance the big organizations like World Vision has not recognized them, but they are at the front line of fighting HIV/AIDS. We select those that are female-headed or women-headed, because in Africa, the female-headed organizations have tended to be more successful than the male-headed organizations. That's why we have that priority. And then the CBO, or the community-based organization, should be working with activities related to HIV and AIDS, such that they fall within our mission of resisting, surviving, and overcoming HIV and AIDS. What else do we do? We also do capacity building of the local organizations that I earlier mentioned of. In terms of in 3 phases that we do the capacity building. 1, we do it in terms of infrastructure. Like I mentioned, most of the times when we start working with them, we have our meetings under the trees. So when we start our capacity building, we start with infrastructure. Can we be in position to establish an office for this CBO? Can they have internet access? Can they have a bank account? Can they have a filing system? And then can we arrange their office in terms of an office desk, a phone, such that they can be recognized by other service providers, the big service providers, that they are actually doing something on ground. Then the next level of capacity building will now come to governance. It's not like we are not appreciating that they already have a system in place, but the system that they have in place may not be, actually in most cases, is not in position to help them get funding. So this is when we come in and say, okay, you have your leadership, you have your chairperson, but are you registered at the local council level? And then who is in charge of decision making? What are the policies governing your community-based organizations? How do you do your financial reports? How do you do your narrative reports? This is where we capacity build them, such that they have a good governance system. And then the 3rd level of capacity building now comes to project management. Because after we have improved on your infrastructure, we have improved on your governance, we now come into project management. If you are given a project, how do you manage it? How do you keep your records? How do you report back to the people who have given you the funds? How do you monitor it? How do you make sure the project is a success? That is the 3rd and the last phase of the capacity building. And then after that, we are sure they can be able to get funding from the other big organizations. That's what is exceptional about CAP 8. The model of partnership has enabled CAP 8 to emphasize learning by doing. In this case, we involve the community-based organizations in the project implementation process. And we follow them up through the monitoring and evaluation system to make sure they are doing the right thing as required in the project management cycle. So we get down at the grassroots, sit with them, look into their records and compare them with the project document and try to bring them back. And then we now introduce in the technical languages, eventually, like reporting, budgeting. We now bring in issues like accountability. By then they are able to cope up with these technical languages as we implement the projects together. Implementation of community projects. I thought that I should, in this presentation, give you an overview of what HIV/AIDS pandemic is as far as Uganda is concerned, which is a replicate to most of the African countries. About 1.2 million people are living with HIV/AIDS, which is approximately 4% of the total population in Uganda. This is similar to Kenya, Nairobi. It's similar to most African countries. Then 52% of the people living with HIV/AIDS are women, and 13% are children. 1.2 million children have been orphaned so far since the epidemic came in. 100,000 become infected with HIV each year, and then 65,000 die of HIV/AIDS every year. That is precisely the picture of HIV/AIDS in the Ugandan community, which is a replicate of most African communities. Now, with that kind of situation in Africa, the impact has been gross. The impact has been on the loss of the breadwinners. Most cases, they lose their fathers. There is decline in school attendance or dropout completely. There is lack of health care because the breadwinner of the family is not there. Therefore, the resources required for basic health care might not be there. There is change in the family structure. Most of the times when they lose their fathers and then eventually maybe their mothers, they are forced to go and live probably with their grandparents if they're still there, or go and live with an aunt or an uncle if they're still there. But based on our experience, they most of the times prefer to live with their grandparents. So, and then eventually there is poverty, and then with poverty, they again be vulnerable to again getting HIV/AIDS, and the cycle keeps on continuing. That's briefly the impact of HIV/AIDS in the Ugandan community. CAP/AIDS projects with local partners. I thought I should also give you enlighten on what we are doing as far as CAP/AIDS. Having looked at the background of HIV/AIDS in the Ugandan community and Africa as a whole, what is CAP/AIDS doing? We have been able, with funding through our Canada office, where our executive director sits, we've been able to implement some projects, a number of projects, like the sustainable livelihood for AIDS orphans and caregivers, our voluntary testing and counseling, because we believe if we are to fight HIV/AIDS, voluntary counseling and testing is the main thing, such that people know what is my status, and if my status is A, how do I behave? If it is B, how do I behave? So we have run some projects on voluntary counseling and testing. We have also run some projects on HIV/AIDS education. We have run projects on home-based care and support, which tackled mainly widows who were most of the times isolated from the actual community because they are HIV/AIDS infected. We have also implemented bicycle distribution programs to enhance home-based care, particularly to mothers who are bedridden in their hearts and there is no one to take care of them. So with the help of the community-based organizations, they're able to use the bicycles to reach out to these people. We have also run projects on prevention of mother-to-child transmission of HIV/AIDS, such that we are in position to save the unborn child in case the mother is infected, such that the burden is fairly reduced. I also thought that I should show you some of the women or the groups that we work with. For instance, that is Aboke HIV/AIDS Women Association. That lady in the white suit, African suit, is called Santa. She is a grandmother. She unfortunately did not give birth to any kid, so she took up the role of taking care of AIDS orphan children. So she has so many, I think by the time CAP/AIDS got in touch with her, she had about 20 orphans that were in her care. And because that's how she started, and eventually she established the Aboke HIV/AIDS Women Association, where other women eventually joined, other grandmothers joined, who were for the same cause, helping the AIDS orphans. And because she's a midwife by qualification, she's a medical midwife, she also had some orphans who were actually infected, so she was helping them access treatment, and take care of them in terms of health care. I also thought I should show you some of the youth that we're working with. For instance, this is a youth group of Pewan youth, which they got this name after the support from CAP/AIDS. We have Justin, who is about 17 years old and lost both of his parents to HIV and AIDS. When by the time CAP/AIDS got him, he had lost hope in life. But he was trained with entrepreneurial skills development, and then eventually supported with a grinding mill, plus his group members who are 15 youth with the same kind of background. and eventually they were able to gain profit with the income generating activity that they were supported to establish, and be in position to make sure that each member of the group was able to get as she and he got, such that each member can own a small kind of little farm taking care of goats. So it's like a diversified kind of source of income from what originally CAP 8 supported them with, and we are proud to hear such stories come up eventually. Jennifer on the far right is one of the beneficiaries and also a group member, and that's her grandfather whom she's now staying with, being an orphan, and those are the siblings that she's supposed to take care of from the little that she's earning from this youth group plus her goats. When we talk about caregivers, we have come across a situation where it's not only women, we also have male caregivers. In this case, this is Bosco, who is a caregiver, and he's also spearheading the role of helping AIDS orphans. And with the support from CAP AIDS Uganda, they are doing piggery and doing extensive agriculture using the oxen to plow, so that they can do a bigger kind of plowing, which I wouldn't call a farm. Having looked at the farms that are in Canada, they're really big. Yes, so they are doing a slightly bigger kind of gardening. Yes, which you could call back home a farm, because before the support of CAP 8, he was doing a very little backyard kind of agriculture for home consumption. But with the help from CAP 8 in terms of piggery, in terms of the oxens and the plows, he's able to plow a bigger kind of garden, and he's able to get what he can sell off, what he can consume at home, and when he sells off, he can get seeds for replanting, and these are improved seeds, and also remain with something to continue with his role as a caregiver in the AIDS-affected communities. So he's proud to show us his progress, and we are happy about that. AHWA is a Boke HIV/AIDS Women Association that has been successful. Actually, Bosco, the one you saw earlier, is one of the caregivers who is belonging to this group, and they now, with the success they now have a good governance, they have a good financial accountability system, they have a good project management system, they have skills and knowledge in program planning, and they're able to do the partnership and monitoring of the beneficiaries that they identified for us to work together with them. So they are now big, they can be recognized by other service providers. For instance, AHWA is now being recognized at the district level, what we would call district. I think here it's municipality? Yes. For them it's called a district. Now by us capacity building AHWA, which is a Boke HIV/AIDS Women Association, now they have been exposed. Now they can be seen as people who are doing something in the community. But if CAP 8 had not come in initially and help with the capacity building in terms of infrastructure, in terms of governance, in terms of project management and learning by doing, they wouldn't have been seen. So we feel it is a success story, since we already had the experience or the report that they are already being funded at the district level. So that's the money cycle. That's how it kind of works. When from Canada we receive the funds, and then it comes to CAP 8 Uganda, which represents Africa, and then the funds are processed and transferred to Africa, which is Uganda office in charge of the countries in Africa that we are working in. Then we, having identified the projects, we then get in touch with our respective community-based organizations, and we do the implementation in partnership, and then after that report back to our office in Canada, and then our office in Canada is responsible for reporting back the feedback we've given them to the respective donors. So this is how the cycle works. and then throughout the project implementation period, and then afterwards when we also start receiving the successful stories, which we call the results of a project. It normally takes a longer time. Then we also recycle the stories back to our Canada office so that our Canada office can share the stories with our donors. It's like a kind of feedback. We must give feedback back to where the money is coming from, such that they are aware that when they sent us this money, this is what it did, these are the changes it did in the lives of the people in Africa, and they are happy to report back. So the cycle keeps on moving like that. That is about Cap 8. Thank you.
How many countries do you work in Africa?
In Africa, at the moment, we are working in Uganda, Tanzania, Nairobi, Malawi, and
Kenya.
and Ethiopia. Did I mention? There are 5 countries. Yeah. Uganda, Kenya, Tanzania, Malawi, and Ethiopia.
How much money is required for some of these projects? For small projects.
For small projects, the smallest project we have implemented is the Look For Foundation project, which is about $24,000.
So that's so it depends on the scale. So some of the projects you saw there
big.
are small components of a bigger project. So the actual amount, like for example, for that youth project there, there's 15 youth who were supported and provided training and the tools so they could start this business. How much did we spend
Just
on
for
those
the
15
just
youth?
for the
Yeah,
youth, about $2,000.
about 2,000.
About how much is 5 million? About $2,500. 5
No,
million.
about $2,200, and that's enough to support. So that supported 15 youth, who then are supporting also younger siblings back home as well. But for us, that was one youth group. In that project, we probably supported about 100 different small enterprises. So the overall project had a much bigger price tag, but the individual projects in terms of individuals or groups who are being supported, it doesn't cost much really.
Claire,
Yeah.
we can't hear you back here.
Oh, sorry. I'll come stand here too. Did you hear the question?
No.
The question was about how much do the projects cost? And so we were just explaining that for the most part, we may be implementing larger programs that would be benefiting, say, 100 different people or supporting 100 different small cooperative enterprises. But each of those cooperative enterprises, like the caregivers or grandmothers groups or these youth groups, may cost as little as $2,000 to $2,500. That's to provide small business training, financial management skills, and all of that, plus the tools and equipment and a little bit of startup capital to get them started.
Who really takes the initiative of these projects, you say? The local group or local community or CAP?
Who takes the lead on these projects?
Companies again.
Yeah.
Can you repeat the question? We can't hear
Yeah.
the question.
The question was, who's leading these small projects that she was talking about?
It's basically the Cap 8 Uganda office in partnership with the respective communities where the projects will be implemented.
So in that sense, are you really responding to the local needs or you judge the local needs by yourself?
I think we are responding to the needs of the local community through our strategy of partnership with them. So at the end of the day, they own the project. We capacity build them such that they're able to successfully own the project.
So the idea there is that the projects are developed in partnership with the community. So the communities are involved in designing the project, in implementing the project, and then monitoring and evaluating the success of that project as well.
So what you do is facilitate to that effect, and then you step back.
That's
And then
right.
let the other organizations that are larger, like World Vision or whatever, come in and support.
That's right.
Okay.
When we capacity build them, because initially when we get in touch with them, they are too small to be recognized by the big funders. That's what makes CapAIDS exceptional. So we capacity build them to a level that they'll be seen or recognized. They'll have an office, so World Vision or SLF, yeah, will come in and say, oh, there is a CBO here. And what are they doing? You know, they'll be attracted to know what these old women are doing, and then eventually they could develop an interest. Another way is, after we have capacity built them, we link them up to the respective leadership in the respective communities. So some funders come directly to the district level and say, what CBOs would you recommend us to work with? So if we have established them enough and linked them to the leadership, and they are now in the records of books and then the accountability at the district level, they can easily be recommended to the other service providers or other funders. So we now phase out at that level.
Right.
So for a group like this Aboke Women's Group, for us, we would see it, for example, as a fantastic outcome if they could be recognized by a group like the Stephen Lewis Foundation. And so that groups like your community here, when you're supporting projects overseas, there's a need for the groups and organizations that you're supporting to have a certain level of capacity so that the Stephen Lewis Foundation can be confident and you can be confident that your funds are being used appropriately, that they're really having the maximum impact on the community. So we sort of come in a step below that and try to work with local groups who are really working hard to respond to the needs on the ground, but may not have some of the systems or tools or infrastructure in place, or sometimes just even language in place, like monitoring and evaluation. They may be tracking their activities or writing things down, but not calling it monitoring of the project. So building the capacity so that they can then access organizations that can support them longer term and really help them to advance the goals of their community.
How available and how affordable are antiviral agents, and does CapAIDS have a role to play in providing antivirals in the treatment of AIDS patients?
What we do is link them up to the health center. For instance, when we